Hi, everybody. This is Dr. Kogan. Particularly, this update is for our clinics, GWCIM clinics patients who had COVID, and also update for anybody who will get COVID. So I gave a little talk about what to do if you get COVID. This is what to do after the COVID. And I decided to do this talk in view of this recent data in pediatric population of dramatic increase in over 100% in a risk of diabetes 8 to 12 weeks after acute COVID. And I want to specify, so this is a CDC data, but I want to say that after seeing hundreds of post-COVID patients through the GW University, we have definitely seen a spike of diabetes in adults, but we're also seeing a spike of a lot of other conditions. And so I think if you had acute COVID, a couple of things you can do to decrease risk of things going forward and evolving into other problems, other chronic medical problems. So first of all, if you're noticing that you're not fully resolving, so let's say a week or 2 weeks after the COVID, you still have symptoms, you really need to talk to a provider. Don't wait for months on end thinking that they're going to go away. They may go away, but they may not. And I think it would be valuable to get assessed to say, what is my individual risk and how do I minimize it? Especially since we don't really know exactly all the possible scenarios. I think it's more important to try early on to aggressively try to investigate if you're not getting better. A lot of people continue to improve after the COVID for weeks, but I would say if you reach the plateau, let's say you've certain symptoms improved within 2 weeks, but you're still lingering and you still have symptoms, that's a time to talk to someone, because if the symptoms are still there, it probably signifies that an inflammatory reaction still persists, or that the mitochondrial dysfunction, we talked a little bit about this last time, meaning that your cells cannot produce enough energy, is still there. And those are the two big things that we're seeing in a post-COVID patients in what we sometimes call as long haul symptoms. So definitely get in touch, but also the things you can do on your own to start kind of aggressively try to manage the things. If the symptoms are more inflammatory in nature, I definitely recommend this product called SPM, and there are now a variety of different brands that making this. Originally it was Metagenics, but now Designs for Health makes the product and others. So SPM is a new product, relatively speaking, just a few years old. It's a product that's called Resolvins. It's a fatty fish oil or fatty acid derivative that helps to resolve the inflammation. So you may have a low-level lingering inflammatory response, and if you just take more turmeric, more fish oil, eat anti-inflammatory diet, it may not resolve. You may continuously have this lingering symptoms. That's when SPM comes in very, very effective. That's one. Definitely, if you feel that your energy have dropped, so you've had a certain level of energy and now you're operating over here, revving up exercise routines, specifically, I would say revving up core muscle training, and also, so that's one. So calisthenics is definitely my preferred. You probably heard me talk about this all the time. I love convict conditioning for the simplicity. You can just get a book or look up on the internet. There are videos on this program. It's about 10 minutes a day, 6 days a week. But any other core muscle strengthening, whatever you do, will probably be sufficient. And the second is definitely what's called HIIT, or high intensity interval training. And because that HIIT is known to rev up mitochondria, it is known to be quite effective in pretty quick time, in contrast to other types of routines. And HIIT can be done walking, running. HIIT can be done just walking slowly, walking faster. There's a variety of different protocols. You want to start with the easiest one you can do without getting totally wiped out after about 3 or 4 cycles. That's second. I put a video on infrared saunas. Definitely, if you have access, that's one that can be very effective at revving up mitochondria and kind of getting over that hump of energy production being low. Definitely, you could consider starting cold training, although cold training is a little challenging when you're feeling down, but it actually can be very effective at kind of getting quickly rid of the depressed symptoms and anxiety symptoms and also bumping the energy up. In terms of the dietary approaches, diet will not effectively quickly clear this. So dietary approaches are very important, but when you're looking at something to quickly move you, I wouldn't think of a diet being most important. I think you don't want to eat crap, but you also don't, if you eat well to begin with, it's unlikely that dramatically changing diet's going to quickly fix this. So I don't necessarily think of that as a first line in post-COVID patients. Although, of course, I also talk to post-COVID patients a lot about diet because a lot of people don't eat well and you have to optimize that. So that's just a side note. And then if the sleep is disrupted, it's a very high priority to get that fixed. And we see a lot of patients post-COVID having sleep altered pretty significantly. And whatever your methods are, you know that I'm very big fan of a low dose THC or low dose cannabis for sleep, or higher dose CBD can sometimes be helpful. But there are lots of different methods. You can definitely try melatonin. You can definitely try calming nutrients, calming herbs. Chamomile, ashwagandha could be effective for some patients. For sure, things like 5-HTP, if you're not taking antidepressants, or antidepressants can sometimes also help for sleep, but there's a whole list. So in short, this is very brief, I know, but my point is I'm trying to keep all the videos relatively brief and then not to go over 10 minutes. But so yeah, if you're continuously having symptoms post-COVID, don't try to wait out too long, because often the longer you wait, the harder it's going to get to manage things. And also, I say if you are continuously getting better, and give you a few ideas, you can support that. And if your rate of improvement speeds up, that's good. And yeah, and I also think that this whole new data on diabetes, we knew this. We knew that the data on diabetes has been out there and all kinds of autoimmune conditions months and years after COVID. We knew there's an increased risk, so there's nothing really new there. Anybody's interested in more details on this whole talks and a little bit of politics, tune in into my Sputnik radio interview today. I think it was earlier in the morning. I see if I will put a link when it comes up into the text here. Well, stay safe, friends. We will send this to our clinic, but I also will post this on my media channels as well. Bye.